Hello, how are you doing, everyone? Thank you so much for joining. This video is very short. It has 5 slides of PowerPoint, and it's going to be very simplified exercise and PowerPoint presentation to show the relationship between the use of NSAIDs and gastritis. Welcome all. The chronic use of NSAIDs. NSAIDs stands for, as you know, stands for non-steroidal anti-inflammatory drugs. So drugs that are anti-inflammatory, they fight inflammation, but they're not derived from steroids. They're not steroids, for example. Okay. The most common we get these drugs over the counter. We don't need a prescription for these drugs. You can go to any pharmacy and get ibuprofen, for example, naproxen. So these drugs we take them for many reasons. Most commonly for fever and pain. So you have joint pain, back pain, headache. We take ibuprofen over the counter, and the headache or the pain goes away. The problem is chronic use, and chronic is relatively defined as a long-term use of something or doing something. So someone, for example, who is taking a blood thinner for a medical reason and they've been taking it for years, that's a chronic use. Chronic use of NSAIDs, and some people abusing these medications, not knowing the complications, not knowing that they might, in the long run, hurt their stomach or hurt their one of their organs in the future as a complication of the chronic use of these drugs. So briefly, we know that we have two types of enzymes that we know: cyclooxygenase 1 and cyclooxygenase 2, for short, COX-1 and COX-2. The COX-1 is well known for its protective properties and function in the GI linings, the inside of our gastrointestinal tract. The cells that lines this tract are protected because of this enzyme that has this property. So COX-1, that's what it does. And COX-2 is responsible for pain and inflammation. It is involved in the process and the mechanisms of pain and inflammation. And NSAIDs, non-steroidal anti-inflammatory drugs, target these two enzymes. So if you have pain, you go and you take ibuprofen. Ibuprofen, what it does block COX-2, but also it blocks COX-1. So ibuprofen blocks both COX-1 and COX-2. So COX, you don't get a pain, but then you get a side effects. You get, in the long run, you're going to have some side effects, and you're going to have some gastritis. You're going to be suffering from inflammation of your stomach. You're going to have bleeding in your stomach, and that's not good. It's very serious. It can even lead into stomach cancer. So the solution is, so this is the clinical significance. Very important to know. If you have someone who's taking ibuprofen for a long time, and you need to let them know, they need to get educated and to limit the use of these medications. There is a drug called Celebrex. It's also an NSAID, but it's selective in its nature, and it does not affect too much COX-1. And therefore, if you're taking Celebrex for pain or for joint pain, for bone pain, back pain, for any other reason, then you are less likely to have the side effects that ibuprofen has, because Celebrex is very selective. It does block COX-2 most of the time, COX-2, but COX-1 is less likely that Celebrex were affected, and therefore you still have that protective function of COX-1. So you don't need to worry too much if you're taking Celebrex. But if you're taking ibuprofen for a long time, that's something that you need to think about, and that's something that you need to always check and follow up with your doctor on a regular basis. Another thing is, in America, we do tend to take over the counter medications for so many reasons, and we use these medications all the time. So if a patient or a person who is elderly and he has a heart condition and he's taking aspirin and now he's taking ibuprofen, then this is very risky, and that's problematic, because that can exacerbate the GI bleed as well. So in conclusion, just this is very general. Avoid NSAIDs, especially the chronic use. Just try to avoid them at once if you can. If you can't, you have to go and see your doctor. Do not just take ibuprofen, or don't just take over-the-counter medications without consulting with your primary doctor. It is very important for everyone to know, and for your family members to let them know also, that they need always to follow up, need to consult, they need to speak with your doctor, because NSAIDs, like ibuprofen, as I said, they can do a lot of things. Not just this, GI bleed is just one of the side effects, but also they can affect your other medications that you're taking. So if let's say you have a heart condition, you have a fluid overload because of your left side heart is not working, is not pumping enough blood, and now you're on Lasix to get rid of extra fluid, and now you're taking ibuprofen. That can be a problem. That can be a problem when you're taking these two medications. Um, and that can be problematic. Okay, so always you have to always consult your doctor before taking herbs, before you take any medications that are over the counter, easy to access. All right. So, and also get enough sleep. Enough sleep is very important because of the stress. Get sleep. Eat well. Fast for a few hours if you can. Be positive and optimistic. And finally, consult your doctor for any medical issues. Thank you so much for watching.